Good afternoon, everybody. Thank you to IPPN for the opportunity to speak with you all today about Children and Young People Services Committees. I hope to be able to maybe pick up on some of the strands that were referred to earlier, not necessarily to claim a panacea for solutions around all the issues that have been raised, but certainly to illustrate, I suppose, some of the methods in which some of the jots that have been mentioned could be joined up in terms of the interagency aspect of working together to address emotional well-being in schools. So I'm based at the Centre for Effective Services. So for those of you who don't know about the Centre for Effective Services, it's an intermediary organisation that supports bringing evidence into policy and into practice. So we work across a range of sectors, including education, health, local and community development, youth, and a few more. So just to give you that little bit of a background, I work very closely with the Department of Children and Youth Affairs, and the project that I'm talking about today, Children and Young People Services Committees, is led by the Department of Children and Youth Affairs at a national level. So what are they? Well, they're local interagency structures to improve outcomes for children and young people. So I'm going to go through a lot of slides and a lot of information quite quickly, and I'm going to refer at the end to a website where you can get more information on what's happening in your county. But they're responsible for improving the lives of children and young people and families throughout the country and throughout your county, whatever county you're working in. They're universal, so they're for all children and young people. But they do have that flexibility to target where there is a need to target. Their age remit is 0 to 24 years of age. And what they do is they bring together a diverse group of agencies from the statutory, community and voluntary sector together to jointly plan and coordinate services in their area or in their county. So there's a national rollout that is still ongoing, and all counties will have a Children and Young People Services Committee. And I suppose they're informed by, or they're set up in alignment with Better Outcomes, Brighter Futures, which is the national policy framework for children and young people. And this is a whole of government document, which I suppose sets out the aspirations and the commitments from across government around what we want for our children and young people in Ireland. And Better Outcomes, Brighter Futures, I suppose its aspiration is around 5 national outcomes for children and young people. And they are that children and young people would be active and healthy, achieving and learning, safe and protected, have economic security and opportunity, and connected and respected. And I suppose the discussion that we're having today about emotional well-being could fit into outcome 1 around health, but it really has an impact, as we've already said, on how children and young people do across all of those 5 national outcomes as well. And Better Outcomes, Brighter Futures aspires to be informed in terms of our work by 6 transformational goals, which are on the left there, around supporting parents, earlier intervention and prevention, which has been mentioned earlier in terms of prevention, listening to children and young people. Somebody mentioned transitions and strengthening those transitions. I suppose my baby, cross-government or interagency working as well. And so informing how we work using those transformational goals, as they're called. And the premise is that by working in that way, we will strengthen the likelihood of achieving those 5 national outcomes. So people talked earlier about a common vision, but that's the national vision for how the lives of children and young people in Ireland will be. And I suppose the reason I put that up there is because that's the framework which informs Children and Young People Service Committees in terms of those 5 national outcomes. So CIPSI have a range, I suppose, of statements around their purpose, and it's really about ensuring that the needs of children and young people in any county or any area are identified and addressed, to plan, coordinate, to ensure effective collaboration, use evidence, so to promote the use of evidence to inform the decision making around what we're planning and what we decide to provide in terms of our services. People talked earlier about resources. Do we need more resources? Do we have enough resources if we change how we use our resources? So one of the items for discussion is around optimising the resources that we have around the table and to promote best participation practice. So to ensure that our stakeholders are involved in the decision making, be that children and young people and families. So this is the national picture at the moment in terms of where we're at, in terms of national coverage for committees, Children and Young People Services Committees. So you can see there that there's a pale green section sort of across the middle and in Dunleary right down. So that's where we still need to establish a Children and Young People Services Committee, and I'm very hopeful that that'll happen shortly with the release of some resources for a support personnel to support that work. So who's on a committee? Who are they? How do we know how can I access a Children and Young People Services Committee? So that is, I suppose, the makeup in general, broadly speaking, of a SIPSI. I'm going to call them SIPSI from now on because it's quite a long acronym or title. So there's on average about 16 people, but that can go up higher, representing a range of services and agencies. And they are senior personnel with a decision-making role in their organisation for the most part. They're chaired by the TUSLA area manager for the area. So all of your schools will be in an area, a TUSLA Child and Family Agency area with a local area manager. And they chair, and the local authority is the vice chair. And I think earlier it was discussed about schools are in communities. So I suppose what I hope you see there is different stakeholders in a community reflected in that diagrammatic representation, talking to each other, planning and coordinating together to try and improve outcomes for the children and young people in their county. You can see there as well, I've highlighted who are the education stakeholders. Education has a prominent space and place at a SIPSI table. And I suppose I would encourage you to become familiar with what's happening in your county, get to know who your representative is, if there isn't one, maybe approach some of your networks about becoming that person, and really use this structure. I suppose these structures will work if people use them and participate in them. But if we don't come to the table, and if we say somebody else needs to do it, then that's where maybe sometimes our work doesn't become as effective as it might be. So you can see there that IPPN and NAPD have a seat at that table. We also have the Education Training Board, NEPS, which obviously we'd like to augment that participation, and just very recently, third level institutions as well, particularly as the age range for SIPSI was 0 to 18 and was extended recently to 0 to 24 to align with national policy. So I suppose this is what they look like. The previous slide told you who's on the committee. So the top green bar there is the actual committee. But clearly there are a lot of practitioners as well on the ground, people like yourselves, middle managers in different agencies, who need to be involved, because the reality is they're the front line, they're the people that actually meet children and young people on a day-to-day basis. So there is a subgroup structure below that committee, and they meet more regularly and plan and discuss and very much inform the plan that the Children and Young People Services Committee develops. So there's a bottom-up approach to planning, and they're doing that planning based on identifying what the need is and what is the reality in terms of what we can prioritise and what can we work together then on. So I suppose carrying on in terms of that plan, obviously the plan's ultimate goal is to improve outcomes for children and young people. And it includes a socio-demographic profile. So people were talking earlier, and I know Rosaline mentioned earlier, around asking schools, what support services are you accessing? What's on the ground out there in your county? So the SIPSI do a very good job of identifying what's moving in your county that's providing a service for children and young people. So they also profile, I suppose, the status of children and young people. How are they doing at the moment with whatever available data is available? They use those two pieces of information to come up with the needs analysis, and then from that they prioritise. And from that prioritisation, they then write an action plan. And I suppose it's important to emphasise here that it's about adding value. It's not about putting in what the Education and Training Board is doing already. It's about looking at what value can we add to the services that we already have if we work together around an issue. And then obviously there's an aspect of review and monitoring. So consultation with children and young people is an integral part of the work of a SIPSI. And they do this, I suppose, formally through the Corlin and Oak Child and Youth Councils, but they also do a huge amount of other work with other, I suppose you could call it sectors or other groupings of children and young people, including early years, young people, it may be in care, parent and toddler groups, the list goes on. So maybe sometimes those more seldom heard groups in our society of children and young people. I just wanted to very briefly just list for you, because I'm not going to go through them, some of the local innovations, I suppose, that have emanated from the work around the table of a SIPSI. So a number of them have provided those foundations, the interagency foundations necessary at local level for the establishment of the jigsaw model of community-based mental health provision. Some have developed critical incident protocols, and your critical incident policies were referred to earlier today as well. And I suppose sometimes the default is, what is the school going to do about it? And sometimes serious incidents can happen outside of school term time. And I suppose this is a way of ensuring that the community and voluntary sector and the state services know and have agreed together and have had a discussion afterwards about who's doing what if a critical incident like a youth suicide or something happens in a county. They also have developed accessible materials, youth-friendly information and materials, and we all know there's reams of information out there, but sometimes it's important to have something that was produced locally, produced with local people, that kind of uses the language of their area and their locality, like the Teenage Health in Kerry booklet that provides information on youth mental health issues. So at the moment, currently, the types of interagency work that's happening across the country, this is just a smattering. Some of it is being supported by SIPSIs, some of it is being driven or led by SIPSIs. There is a Youth Mental Health Steering Group in Sligo Leitrim. They're also providing the Incredible Years programme up there. Fingal is looking at a collaboration for the development of a part-time adolescent substance abuse counselling service. There's the Killarney Schools Mental Health Project, and I could go on. So it's just to really give you an example of the range of interagency work that you may or may not be involved in, or you may or may not be aware of at the moment, and to flag for you that it's not an empty space. I think we've already said here today that there's a myriad of programs out there, there's a myriad of approaches. What we're trying to do is ensure that what is implemented with, I suppose, an evidence approach, informed approach behind it. So in terms of education sector representatives, the type might be very small there, but I suppose it's really just to flag and emphasise for you again that IPPN is at that table. And you may recognise a name up there. This will be relatively fluid because obviously as people move on in their roles as principal, somebody else will be nominated into the seat. But I would encourage you maybe to take a look at who is my person in my county that I need to get in touch with. And if your county isn't there, perhaps that you would approach the NAPD or the IPPN and offer your services in terms of sitting at that table. And I suppose it's important to say that those people, it's very important that they behave like a nominee for their network and communicate back to their constituency of school managers and principals in their county about what's happening and involve you in that discussion at the SIPSI table. So I'm just going to fly through these. We also have ETB reps, and again, it's a growing, I suppose, space in terms of the third level as well. So the impact in terms of interagency work, I mean, we really do need to apply an evidence-informed approach to this. So how do we know that it works? So a lot of the reports that have come out around serious cases around child welfare would have pointed to the fact that maybe people weren't sharing information, people weren't talking to each other. So I suppose there's an assumption there that if we can work together, when it's appropriate to work together, we can maybe catch some of those situations and maybe provide a better service. There is some evidence out there to say that we can provide improved access and a speedier response if we work in an interagency fashion. And there's some evidence of some improved outcomes, maybe like a young person getting to stay at home or school attendance is improved. But again, it's hard to, I suppose, disassociate that from all of the other external variables that are going on, that you're doing in your school, and make that direct connection with interagency work. But there is some evidence about that out there. The evidence is more clear around, for professionals, interagency working can help support them in their work so that they enjoy their work more, that they're more familiar with the services out there. And I think Gordon referred to that earlier about us knowing what each other's service is about and having the confidence then maybe to actually use those services. And for agencies, I suppose, the paymaster is around having a greater, more efficient response. So just finally, I wanted to flag with you that we have a website, a national website, sipsi.ie. We'd be delighted if you visited the website and had a look at what's happening in your county, maybe look at what's informing what we're doing, why we're doing it. There's lots of interesting material there, and you will find also information on your local coordinator. So each committee is supported by a local coordinator, and they will have a raft of information on their county. I think that they probably know everything that moves in the county in terms of provision of services. And I can see one of them down the back, so I hope she doesn't shoot me for saying that, Emma, that they really, really are on top of what are the responses out there around children, young people and families in their county. So you can search by county, so please do sign up to the mailing list to keep in touch with us, but I would also strongly urge you to get in touch with your local networks to see what's happening and see whether you can get involved either at a subgroup level or at the SIPSI table as well. And I suppose just to really, in closing, to say that we recognise that promotion of emotional well-being under, be it outcome 1 of the national outcomes for children and young people or other outcomes, it's not the sole responsibility of one agency, it's everybody's business. And that's why it's important that we do have those community structures at the SIPSI table, because children predominantly live in communities, not in the schools. So this is what we are trying to do, is bring all of those stakeholders around the table. So there are those interagency structures, please use them. You have an important, prominent place and space at the table, and you're very welcome to bring your issues to that agenda. There is a range of local activity, so maybe it might be a question of just being aware of it, or it might be a question of where there isn't local activity, raise awareness of that so that some sort of effort can be made to rebalance the distribution of responses and services to other counties or to other communities. And finally, just in closing, I want to say to you, these are, I suppose, crucial messages that I think have resonated for quite a number of years around interagency working in Ireland. But when we work together, we can make a positive difference in the lives of children and young people. Working together in a sustained way is challenging. It takes time, and it requires continuous learning. But it is worth it, and I think your participation at today's event is a reflection of your belief in that it will be worth it. And we're doing this through Children and Young People Services Committees. So thank you very much for your time.